clear sections so you can use it as a study or reference guide. Mefenamic Acid, Complete Drug Monograph. 1. Generic name, drug class, brand names, drug forms, generic name, Mefenamic Acid, drug class, nonsteroidal anti-inflammatory drug, subclass phenamates, brand names varies by country, Ponstel, USA, Ponsten, UK, Asia, Dolphinol, Philippines, Meftal, India, drug forms, capsules, 250 milligrams, 500 milligrams, tablets, 250, 500 milligrams, oral suspension, syrup, usually 50 milligram 5 milliliters or 100 milligram of 5 milliliters. Now, definition. Mefenamic acid is a nonsteroidal anti-inflammatory drug that provides analgesic, anti-inflammatory, and antipyretic effects. It is mainly prescribed for short-term relief of mild to moderate pain, particularly menstrual pain, dysmenorrhea, musculoskeletal disorders, and post-surgical pain. 3. Mechanism of action. Mefenamic acid inhibits cyclooxygenase enzymes, SCOX1 and COX2. This prevents the conversion of arachidonic acid, prostaglandins, and thromboxanes. Reduced prostaglandins, less inflammation, pain, fever, and uterine contractions. It also has a mild effect on platelet aggregation and renal blood flow. Number 4 uses therapeutic effects. Relief of mild to moderate pain, musculoskeletal, dental, headache, postoperative. Primary dysmenorrhea, period cramps. Short-term treatment of arthritis symptoms, pain, swelling, stiffness. Fever reduction, in some countries, though not first line. 5. Indications. Primary dysmenorrhea, acute pain, muscular postoperative, dental pain, mild to moderate migraine attacks, fever off-label. 6. Contraindications. Mefenamic acid should not be used if known hypersensitivity to mefenamic acid or other NSAIDs, history of aspirin, NSAID-induced asthma, rhinitis, or urticaria, active peptic ulcer disease, GI bleeding or perforation, severe heart failure, renal impairment, or hepatic impairment, perioperative pain in patients undergoing coronary artery bypass graft, CABG surgery, late pregnancy, 3rd trimester. Number 7. Precautions before taking this medicine. Patients must inform their healthcare provider if they have history of ulcers, GI bleeding, Crohn's disease, or ulcerative colitis, cardiovascular disease, hypertension, heart failure, ischemic heart disease, stroke risk, renal impairment, NSAIDs may worsen kidney function, liver disease, drug is metabolized hepatically, asthma, risk of NSAID-induced bronchospasm, pregnancy and breastfeeding, avoid in 3rd trimester, small amounts may pass into breast milk, elderly patients, higher risk of GI bleeding, renal impairment, cardiovascular events. 8. How to use. Take with food or milk to reduce stomach irritation. Use only for short-term treatment, 7 days, unless otherwise prescribed. Swallow capsule, tablet whole with a glass of water. 9. Dosing information, adults, initial dose 500 ml orally once, maintenance dose 250 milligrams every 6 hours as needed, maximum dose 2,500 milligrams per day. Dysmenorrhea, 500 milligrams initially, then 250 milligrams every 6 hours, starting at onset of menses. Continue for 2 to 3 days, not longer than 7 days. Children 14 years, same as adult dosing, consult doctor. Children 14 years, safety and efficacy not established. Renal hepatic impairment, avoid use. Number 10, missed dose and overdose. Missed dose, take as soon as remembered. If next dose is near, skip the missed dose, do not double. Overdose symptoms, nausea, vomiting, abdominal pain, drowsiness, dizziness, seizures, coma, rare, severe cases, renal failure, metabolic acidosis. Treatment, supportive care, gastric lavage, activated charcoal, symptomatic therapy. Stop or avoid taking. If severe stomach pain, vomiting blood, or black tarry stools occur, allergic reaction, rash, swelling of face, tongue, difficulty breathing, chest pain, shortness of breath, slurred speech, weakness, possible cardiovascular event, yellowing of eyes, skin, dark urine, possible liver toxicity, unexplained swelling, weight gain, or decrease in urine output, possible kidney issues. Number 12, side effects. Common mild, nausea, vomiting, diarrhea, constipation, dyspepsia, heartburn, abdominal pain, dizziness, headache, drowsiness. Serious, rare but dangerous, GI bleeding, ulceration, perforation, severe allergic reactions, anaphylaxis, bronchospasm, hypertension, edema, heart attack, stroke, hepatotoxicity, elevated liver enzymes, jaundice, nephrotoxicity, acute kidney injury, hematuria. Number 13. Vital information, black box warnings. Cardiovascular risk, may increase risk of serious cardiovascular thrombotic events, MI, stroke. Risk increases with duration of use, higher doses, and pre-existing cardiovascular disease. Gastrointestinal risk may cause serious GI adverse events, bleeding, ulceration, perforation, which can be fatal. Risk is higher in elderly and patients with prior ulcer disease. Use the lowest effective dose for the shortest possible duration. Number 14. Drug interactions, other NSAIDs, aspirin, GI bleeding risk. Anticoagulants, warfarin, heparin, antiplatelets, clopidogrel, bleeding risk. SSRIs, SNRIs, sertraline, duloxetine, risk of GI bleeding. Corticosteroids, prednisone, risk of GI ulcers. Diuretics, ACE inhibitors, ARBs, renal function, risk of kidney injury. Lithium levels, toxicity risk. Methotrexate toxicity. Alcohol, stomach irritation and bleeding risk. Thank you. Have a nice day.